All right, good morning, everyone. Good morning. I want to welcome you. I'm Congressman James Walkinshaw. I want to welcome you to our 11th District 2025 open season event. And some of you were here last year, probably many of you were here last year, and I stood in for Congressman Connolly, who had recently received his cancer diagnosis. And I just want to say what a great honor it is to represent you all and to try to continue his work in many ways. Today, most importantly, by bringing us together to talk about open season. And Congressman Connolly hosted 16 open season events like this. And it was actually a tradition we picked up from former Congressman Tom Davis. And we need to go back maybe and see when the first 11th District open season event occurred, but we are at least 20 years into this annual event, and I want to thank you all for being part of it. Thank our expert guests for helping us to make it possible, and the incredible staff in the 11th District office. Our forum brings together federal health benefit experts to help answer questions you, I'm sure, have. Unfortunately, there is a change this year in that the administration has refused to send a representative from OPM to help directly answer questions regarding FEHB, the Postal Service Health Plan, and Fed VIP. In response, I did send a letter to the OPM director asking for a briefing and more information on plan changes to help us navigate this period. And if I receive that information, we'll find ways to share it with you. Unfortunately, from my perspective, this is another example of the administration's disregard for federal employees and retirees. You all know that Northern Virginia and the 11th District are on the front lines of the agenda that we've seen from the White House. While we're today and 1 month into the government shutdown, the reality is that here in our region, we've been living through a rolling shutdown of the federal government for the last 10 months with entire agencies dismantled, thousands of federal workers fired or pushed out, sometimes illegally, and a hollowing out of federal agencies that serve the American public. And that makes today's event even more important than normal. During this really challenging time, it is absolutely critical that federal employees and retirees have the tools and information that you need to protect your health and financial security. With that, I am very pleased that while we don't have an OPM representative, we do have two incredible guests here who will help guide us through this year's open season and the options available to federal employees, retirees, and their families. We'll hear later from Ms. Mercedes Johnson from NARF and Mr. Kevin Moss, who is the editor of the Consumer Checkbook Guide to Health Plans for Federal Employees. Very excited to have them both to help us today. This open season will include the Federal Employee Health Benefits Program, the Postal Service Health Benefits Program, the Federal Employees Dental and Vision Insurance Program, and the Federal Flexible Spending Account Program. And let me start just by noting that the deadline to sign up for or change your benefits is December 8th. So make sure you start comparing and contrasting plans to select the best coverage for you and your family now. The FEHB is the largest insurance program in the world, where private insurance companies compete for the opportunity to provide health care coverage for millions of federal employees, retirees, and their families. In 2026, the program has 47 participating carriers, offering a total of 132 plan options. 2026, though, marks the second year in a row that will see double-digit premium increases in the program. The average increase in rates is 10.2%. And on average, the government contribution towards premiums will increase by 9.2%, and the enrollee share of premiums will increase 12.3% on average. Some plan obviously will have smaller increases and some will have larger ones. And open season gives you the opportunity to hopefully mitigate those increases by reevaluating your plan against your needs and your budget. The Federal Employee Retirement System, or FERS, COLA for 2026 will be 2%, and the CSRS COLA will be 2.8%. Existing law, unfortunately, allows that unfair disparity between the annual COLA that annuitants receive under CSRS and FERS, and that's one of the reasons why in my first week in Congress last month, I took over the Equal COLA Act, which is legislation that Congressman Connolly had introduced, which would create a more just system by providing long overdue parity between those two federal retirement systems. It's clear that the current formula used to calculate COLA needs to be updated. 2026 marks just the second year, and last year we spoke about this. It marks the second year of the Postal Service Health Benefits Program, which is a program for eligible USPS employees, annuitants, and their family members. It was established by the Postal Service Reform Act of 2022. And for 2026, the program has 17 carriers offering 75 plans. The increase in rates for the Postal Service program is 9%, and on average, the government contribution will increase 8% and enrollee share will increase 11.3%. Just as with FEHB, if you're enrolled in a PSHB program, reviewing your enrollment during open season is an opportunity to mitigate those increases by ensuring that your plan meets your needs and your budget. Just as it's true that you need to review your FEHB plan, open season gives the opportunity to review your Medicare coverage. And this is just to make things more complicated. Medicaire's open season deadline is December 7th. So the FEHB open season deadline is December 8th, and Medicare is December 7th. So don't wait till the last minute on either, is I think probably the best approach. On the Medicare front, the standard Medicare Part B premium is projected to increase by $21.50 from $185 to $206.50. The Part B deductible is projected to increase by $17 from $240 to $257. And the Part A deductible for inpatient hospital services will increase by $40 to $1,716. There is some good news in 2026. The first 10 prescription drugs with high costs will be available at lower Medicare negotiated costs, thanks to the Inflation Reduction Act. The savings from Medicare negotiation will lower out-of-pocket costs by an estimated $1.5 billion in 2026 alone. And I'll just share a couple of the 10 prescriptions that will see lower costs in 2026. Januvia, which treats diabetes, will go from $527 in 2023 to $113 in 2026. Stelara, which treats psoriasis, psoriatic arthritis, Crohn's disease, and ulcerative colitis, will decrease from $13,836 in 2023 to $4,695 in 2026. And Entresto, which treats heart failure, will decrease from $628 in 2023 to $295 in 2026. So some significant reductions in out-of-pocket costs for those 10 drugs. The next round of 15 drugs selected for negotiation account for an estimated $40.7 billion in prescription drug costs for the Medicare program each year. Among those drugs selected for the next round are Ozempic and Wegovy, which are a few of the driving forces behind the increases in both Medicare and FEHB costs this year. The rising costs of prescription drugs affect millions of Americans, especially older adults, and I'm committed to making changes to save lives and improve the quality of life for older adults across the country by bringing down the cost of prescription drugs. I want to say just a few words about our efforts to support federal employees, current federal employees and federal workers in the current situation. I've taken up a number of pieces of legislation that Congressman Connolly championed. I'm the House sponsor of the Saving the Civil Service Act, which would prevent the politicization of the nonpartisan civil service by blocking the Trump administration's implementation of Schedule F. I'm the co-sponsor of the FAIR Act, which would provide federal employees with a 4.3% pay raise in calendar year 2026 based on a fair formula of the pay raise that federal employees should be receiving. As noted earlier, I'm the lead co-sponsor of the Equal COLA Act to bring equity to the CSRS and FERS COLA. I've introduced or taken over the Family Building FEHB Fairness Act, which would direct OPM to require all FEHB plans to cover IVF services, which is a topic that has come up at this open season event many years. Also excited to share that I've been appointed to serve on the House Oversight and Government Reform Committee, a committee that Congressman Connolly served as the lead Democrat for many years. It's a committee that has jurisdiction over many of the issues impacting federal employee pay, workplace protections, and benefits. And I'm going to work there to make sure that we have a strong voice for our federal workforce and making the federal government more effective and efficient for the American people. I know this is a very difficult time for our community, especially for federal workers, as we've passed the 1-month mark on the government shutdown. Unfortunately, in the House of Representatives, the leadership there has refused to sit down and negotiate to keep the government open, or reopen the government, and address the healthcare affordability crisis that we're facing in this country. And we're not here to talk about the Affordable Care Act today, but I will just use this opportunity to note that if Congress doesn't act to extend the enhanced premium tax credits, a family of 4 in Northern Virginia making $65,000 a year will see their premiums increase by more than $2,500, a 200% increase in their health care premiums. I heard earlier this week from a constituent, a family of 3 in their 20s, have a newborn child at home, and they logged in to the exchange to figure out what health insurance plan they can afford next year. They're on the exchange this year. When they saw the price increases, they saw their premiums would double or triple, they had to make a hard choice. And the choice they made is that they're going to buy health insurance for mom and for their newborn baby, but dad is going to go without health insurance in 2026. And those are the decisions that families across Northern Virginia and across the country are making right now, and why it's so critical that Congress acts. I've also co-sponsored a number of bills to protect federal employees and contractors during the shutdown. Emergency Relief for Federal Workers Act, which would allow employees to withdraw from their retirement accounts without penalty during a shutdown. The Shutdown Guidance for Financial Institution Act, which would direct regulators to issue guidance for banks and credit unions to support federal workers and contractors during the shutdown, and a number of them are doing that already. The Emergency Relief for Federal Contractors Act, which would provide penalty-free withdrawals from retirement accounts during a shutdown, and the Fair Pay for Contractors Act, which would guarantee back pay for contract workers. Federal workers under the law are guaranteed to receive their back pay when the shutdown ends, whether they're furloughed or not during the shutdown. The same is not true of contract workers. In addition to the normal challenges of a shutdown that many of us have lived through, the administration in this shutdown has attempted to use it as a justification to implement mass reductions in force, or RIFs. They've attempted to fire 4,000 federal workers on the first day of the shutdown or the first week of the shutdown. Thankfully, the courts have agreed with the argument that I and others have made that those firings were and are illegal. The shutdown does not give the administration, any administration, legal authority to fire federal workers. In fact, quite the opposite. The administrative and legal work that's required to implement a RIF is a violation of the law, of the Anti-Deficiency Act. And we made that argument when they announced the firings, and to date, courts have agreed with that argument and have blocked those firings from moving forward. And we're going to continue to advocate on behalf of those federal workers and others who have been impacted by this administration's policies. With that, I want to introduce our first guest, Ms. Mercedes Johnson. Ms. Johnson has over 39 years of experience in federal benefits and human resources, specializing in FERS, CSRS, and federal and DC judicial retirement programs. She served as a benefits specialist at the Administrative Office of the U.S. Courts, and later as HR specialist, benefits officer, and acting deputy director of human resources for the DC courts. Following her federal career, she's continued to share her expertise by developing and delivering training, webinars, and articles on federal retirement and benefits for the National Active and Retired Federal Employees Association. Please welcome Ms. Mercedes Johnson.
Thank you. That's a good one. Thank you so much. I am so glad to be here today. It's my first time doing this program. I want to definitely thank the congressman. I want to thank his wonderful staff. I appreciate them having the confidence in me to be here with you all today. Yes, I do sound old now. I have over 39 years of experience in the federal retirement and benefit programs. I would also tell you I am a proud retiree under this system. I am also a proud civil servant. I say once you're a civil servant, you're always a civil servant. So I do wear that very, very proudly. But that's not enough about me. Today, we're going to talk about the Federal Employees Health Benefit Program and the Postal Service Health Benefit Program. I don't want to forget that. So, you know, Postal Service is only a year old now, their system, okay, their health insurance system. And so we want to make sure we include them. They also have their benefits administered by the Office of Personnel Management as well. So both groups, whether you're under FEHB or the Postal Service Health Benefit Program, are going to embark in an open season. You all know about open season. We have it every year. It's going to begin on November 10th, and it's going to end on, as the congressman said, December 8th. Yes, the prices are increasing, and they increased last year as well. That's why it is very important that we all look at these plans and we pick the best plan that works for us. Now, under the FEHB program, there are 47 carriers, okay, and there's 132 plan options under FEHB. Under the Postal Service Health Benefit Program, 17 carriers, and there are 75 plan options. And there are fewer than a dozen dental and vision carriers through FedVIP, the Federal Employees Vision Insurance Program. Because during open season, not only can you change your health insurance, you can also change your dental and or vision coverage as well. Open season allows us to change that, okay? We can also cancel it, and we can re-enroll. The only caveat, I always say this every time I talk, for my retirees, are you in the house today? Okay, yeah, okay, you know who you are. Retirement's wonderful, isn't it? Well, for my retirees, you gotta be careful during open season. Once you cancel your health insurance during open season, you can never get it back again. So we wanna be careful. We don't wanna cancel it during open season. Yes, the plan prices are increasing, as we said before. For FEHB, the average enrollee increase is 12.3%. For the Postal Service HB, the average enrollee share increase is 11.3%. Why are the prices going up? Okay, well, every year OPM negotiates these prices with the different carriers. Okay, but primarily the prices are going up because of the rising costs for healthcare providers and suppliers, greater utilization of prescription drugs, particularly the GLP-1, okay, medications and specialty drugs. And they're also citing higher behavioral health spending as access and utilization continue to expand. So those are the primary reasons in which OPM stating there is a increase in these prices, okay? But I also want to give you some good news. There are some changes coming on down the pike, and a couple of them are carriers must now continue next year to provide at least one opiate rescue drug agent at no cost with expanded education on safe use. HOM plans, I can't speak today. HMO plans in states with IVS mandates were required to propose benefits that met those mandates, resulting in an expansion of coverage for these federal families. So that's another good positive. Also, carriers must now broaden behavioral health networks and allow out-of-network care when wait times are excessive. Okay? And carriers must continue to cover the FDA-approved medications, including at least one GLP-1 and 2 oral options, plus behavioral and nutritional programs as well. And I'm sure if I forgot any, Kevin's going to come up behind me and say a couple as well. But you want to keep in mind there are some changes. Also for the dental vision insurance program, we say FedVIP for short. I always tell people when you see the D and the V, think dental and/or vision. Dental carriers must now offer 2 routine exams and 1 emergency exam per year. Several carriers have added preventive benefits for children under the age of 3 and pregnancy wellness coverage as well. And one vision carrier expanded to 100% diabetic coverage in-network, while another added coverage for orthopedic training for eye movement disorders. Okay, so there are some good things coming down the pike. We have to keep that in mind as well. Going back to open season, if you are a retired employee, whether you're under FEHB or the Postal Service Health Benefit Program, you know you can enroll through OPM's website. They also have a phone number on their website that you can call and enroll on the phone. And you can also mail in an enrollment form. Same thing for Postal Service. You're just going to use a different number, okay? And pretty much the same address. But I have that information here if someone wants it later on. Also, with open season, if you are an active employee under FEHB, your coverage will be effective January 11th. If you're under the Postal Service Health Benefit Program or you're a retiree, you remember we raised our hand, if you make a change, your coverage will be effective January 1st. Okay, so keep that in mind as well. Again, I am here from NARF. I don't know if anybody in this room is a member of NARF. Look, she raised her hand. She said, I am. Okay. One thing about NARF is, it's not only for retirees, it's for active employees as well. They advocate for us, and they give out wonderful information, okay? So they asked me if I would come and help out today, and I was happy to help out. With NARF, you can get some questions answers. They have an email where you can write in questions, whether it's about health insurance, retirement, Social Security, or Medicare. They also have a series of webinars. I happened to teach a webinar, and I believe it was yesterday. The days are starting to commingle a little bit. A lot of webinars coming down the pike, and I just want to give a plug for them. They have 4 webinars coming up in the month of November concerning open season, okay, and concerning open season and Medicare, all right, which is a sticky topic for everybody. I bet I can get an amen on that, right? Very complicated, isn't it? But luckily, we do have people like Kevin and myself and experts that are willing to help you. We pretty much never turn anybody down, okay? So I'm going to stop talking, and I am going to turn this back over to the Congressman.
All right, thank you, Mercedes, and it's a reminder I need to renew my NARF membership.
Yes.
As an active federal employee, so I need to pay my money and do that. It's great benefits. It's now my great pleasure to introduce our next guest, and if you've come to this event for many years, as I have, and You were used to seeing Walt here with us, and Walt has retired, but he promised us that Kevin can do an incredible job, and I know he will. Kevin Moss has more than 20 years of experience leading the development of the Guide to Health Plans for Federal Employees, a checkbook guide, which is, and many of you have utilized it, I'm sure, a trusted decision support tool used by nearly 1 million federal workers across more than 50 agencies to choose the FEHB plan that best meets their needs. Please welcome Mr. Kevin Moss.
Thank you, thank you, Congressman. And thank you to the staff for having me. Welcome, everyone. During open season, I think open season is an exciting time for nerds like me about FEHB plans, but we heard a lot of the details about the program, and now what are we going to do about it? And the first place to start, the first place that I tell everyone to start is what has changed in your current plan. So most of you have a plan, and you've heard about the premium increase. It's 12.3%, a little bit better this year than last year. Last year we were at 13.5. But the premium is going up in every single plan. So the plan that you have this year is not the plan that you're going to get next year. The premium has changed, but as the Congressman mentioned, there's differences in terms of how these premiums change. Next year, 23 plans, the premium's actually decreasing. 57 plans, the premium's increasing, but below that 12.3%. 49 plans above that average. You need to know how your plan is moving and in what direction, and which of those zones is your plan in. Best place to look is the official FEHB plan brochure. The very last page of that plan brochure has the rates. You'll be able to see the government contribution, the enrollee contribution. And while you're there in the plan brochure, make sure you're looking at Section 2. This is the most important section of the plan brochure. It is changes for 2026. You may find that not only is your for sure expensive premium going up, but that your benefits are going up. Anyone that's enrolled in a GEHA plan, either high or standard, there are over 2 pages of benefit changes next year, including the coinsurance rate, what you pay when you go see, when you use healthcare services. There's a change to that benefit. If you're enrolled in Blue Cross Basic or Blue Cross Standard, and many of you I'm sure are, there are 2 pages of changes on Section 2 of the plan brochure that may impact what you have to pay out of pocket. One really huge thing that's different next year is we have an entire carrier that has left FEHB. They remain in PSHB. It is NALC, the National Association of Letter Carriers. They had 2 plans in FEHB, NALC High and a consumer-driven health plan, and many annuitants were also enrolled in a Medicare Advantage plan with NALC High. Something that is unprecedented this year is that OPM has decided that the default enrollment plan for folks who are losing that plan and do not make a positive election will be GEHA High, which is the second highest nationwide PPO plan next year in terms of premium. The law says that it's generally the lowest cost nationwide plan that doesn't charge a membership fee and is not a high deductible health plan. But OPM has reserved the right to choose GEHA High. So if you are losing your NALC plan, it's more important than ever that you are looking to see which plan is the best fit for you. Maybe it is GEHA High, but if you want to decide for yourself, you will need to make a positive election during open season. Active employees have more options to save money than annuitants. Unfortunately, there are tax savings programs that unfortunately do not get the type of participation that we'd like to see. A sad statistic is only 20% of all federal employees participate in the flexible spending account program. So this is a way to save roughly around 30% for money that you set aside in a flexible spending account. And when you make that payroll deduction and it goes into the FSA and you pay for approved healthcare expenses, it's about a 30% savings. The flexible spending account program has the same open season dates as FEHB. If you are an active employee, this is a guaranteed way that you can save money on healthcare costs next year. The other thing that federal employees, active federal employees that that aren't enrolled in Medicare yet, should consider high deductible health plans with HSAs. HSAs are a powerful way to both save for healthcare costs that you expect today, but also can help you when you retire. You can use your HSA to help reimburse on things like the Medicare Part B premium or any other healthcare expenses, and you can choose to make non-medical distributions out of your HSA once you turn 65. In many ways, it becomes a traditional IRA at that point. So that is another plan option that I think is worth considering next year. And then let's talk about annuitants for a second. Two pieces of advice here. First is Medicare Part D. The Inflation Reduction Act dramatically changed how Medicare Part D works. One very important benefit that started last year with all Medicare Part D plans is the catastrophic limit. This year it was $2,000. It's going up to $2,100 next year. But if you have moderate to high prescription drug costs, Medicare Part D could save you a considerable amount of money. Mercedes and I were talking earlier, and we were talking about GLP-1s, and on one plan, when you use the prescription drug pricing tool, you'll find that without Part D, you may have to pay upwards of $700 for a 1 month supply. With Part D, it goes down to $50. There can be dramatic savings from having Medicare Part D. Not all FEHB plans offer Medicare Part D. There's only about 20, but all the Blue Cross plans, GHA High, actually, let me rephrase that. One of the changes that's happening next year, FEP Blue Focus for Blue Cross is no longer offering a Part D plan. But if you're in Blue Cross Basic or Blue Cross Standard, Part D is there. I think it's a way to save money, unless one of three things. You're subject to income-related monthly adjustment amounts. This is higher income individuals. Those income thresholds are rising next year, $109,000 for single filers, $218,000 for joint filers. If you're not subject to IRMA, Part D will be free, no extra premium. If you use pharmaceutical discount coupons, you lose access to those with Part D coverage. And if you spend a considerable amount of time overseas, Part D may not be the right fit for you. But if you're none of those, Medicare Part D, you definitely want this, and your plan will try to automatically enroll you into this as the default prescription drug coverage. If you're in one of those plans, my advice, take a look at it. All the carrier websites now have prescription drug pricing tools where you can put in your prescription, your dosage, your pharmacy, and you'll get an out-the-door price of how much that will cost. And then one final piece of advice for annuitants. If you have Medicare Part B, you may want to consider Medicare Advantage plans. These are some of the lowest cost health plan options for annuitants, and they're significantly better than what you can find in the commercial Medicare Advantage market, mostly because you only have to be in that plan for a year. You can switch any open season. If you had prior authorization issues or some other type of problem in one of them, next year you could switch out of it. But many of them offer generous Part B premium reimbursements, zero out-of-pocket health care costs besides prescription drugs, and probably lower premiums than the plan you're on. In the checkbook guide, we show thousands of dollars of savings in estimated yearly costs in some of the Medicare Advantage plans that are out there. So I think those are kind of the main things that I wanted to say, but I think now we really want to hear from the audience for any questions that they have.
All right, thank you, Kevin. We're going to go ahead and open it up to questions from the audience, and we have microphones on both sides, but we probably need somebody in the middle, right? And we'll rotate. We'll start here on my left. Chris has a microphone there, so we have one in the front.
Hi there. Hello. I don't know if you can hear me, but I'm foreign service benefit program is not meant for women over 40. So you can't bank embryos, you can't, this year they're offering cryopreservation, but it's not enough for us. Really, more plans need to be out there for people like myself who are going through those, because IVF is not cheap. And when you don't cover things like cryo and PGTA and things like that, you add thousands of dollars a month in extra expenses. And so I am very grateful this year Blue Cross Blue Shield has been good to us after the millions of appeals we've had to do to get coverage. But these plans shouldn't be so difficult to even get coverage. And so one thing is that the brochures for unique situations like IVF and GLP-1s should be more clear on what's covered and what's not. And I myself am on a GLP-1 too, because when you're on IVF, they go hand in hand, because women who are overweight are infertile usually. So, you know, those are the things that are important to people. It's very disappointing that you guys have allowed the drug manufacturers to essentially provide financial kickbacks to companies to decide which coverage they're going to have. So between Wegovy and Zepbound, essentially Zepbound will be on almost no plans next year covered, and that's what a lot of us are on. So our coverage decisions are really limited to what we can be on based on our unique situations, but a financial determination on a cost of a drug shouldn't be why we get covered for something that was covered this year, and that is what's happening with those drugs. And those drugs save us money because they keep us from getting those illnesses that you get when you're overweight. And so, like I said, they go in hand with infertility, but they go in hand with other things. And so I do appreciate the plans, but there needs to be more oversight, and it needs to be easier to get things covered and appeal things. So I appreciate it, but thank you.
Thank you, and you know, I'll just say, as you know, I think Congressman Connolly worked for many years to try to press OPM to press the plans to offer IVF coverage, was unsuccessful, and that's why he introduced the FEHBP IVF Fairness Act, which I've taken over, so that legislation is introduced. I'm not optimistic that the majority will allow a vote on that this year, but I think it's something I'm going to keep pushing for, and could be part of a package of larger federal employee and retiree reforms that could move at some point in Congress. So I'm not going to give up on it. I don't know if there's anything else Kevin or Mercedes want to add on that.
Just a couple of things. You're right about the nationwide PPO plans that offer IVF benefits. It is Blue Cross Standard, GHA High, Foreign Service, and if, you know, that, obviously, I think you are in the right plan. Also, there are local HMOs, though, and that is actually, despite IVF still being an optional benefit for plans to provide, it is no longer an optional benefit if you're an HMO that operates in a state that has an IVF mandate. And so next year, United plans in the DC area, as well as Aetna plans in the DC area, have added it, and that adds to Care First plans in the DC area that have it as well as Kaiser. On GLP-1s, one thing that OPM has done is they've told the carriers that they need to make it easier for people to find out how much a drug costs. Because if you go to the plan brochure and they tell you it's a 30% coinsurance, I think everyone's going to say, well, what's the math? 30% of what? There are prescription drug pricing tools on the carrier websites now. Blue Cross has one of the best ones, but you can also find them on the other carrier websites where you can put in your drug, you can put in your dosage, you can put in the pharmacy that you want to go to, and you'll get a price. And there is a lot of price variance out there. Unfortunately, it does take a lot of homework in going to each carrier's website, because OPM has not mandated that the carriers provide their prescription drug formulary in machine-readable format so that folks like OPM and us can do an integrated prescription drug lookup tool and make that easier. We're hopeful that OPM will do that in the future.
I want to add to that also. So Blue Cross Blue Shield, I'm sure as you know right now, this year when it came to the GLP-1s, I think the cost was about $600 to $700 a month, right?
$775.
Okay, who's counting? Okay, I got you. I would say to you, and I'm not sure how Giha High works with IVF. I think you said it does.
Giha High is definitely not going to be a
Okay.
top priority
Yeah.
next year because they use progeny and it's very difficult to get
Okay.
coverage.
All right. Because I was going to say.
Everyone's going to Blue Cross.
Yeah, I was going to say, because Gia High, I do know they cover more for the GLP-1s. You know, I think it's about $100 or less than $100 a month. So that was something I wanted to throw out. Yeah.
From Novo Nordisk or from Eli Lilly, cheaper than you can using your health insurance. So
Yeah, that
I'm
shouldn't be
fine
that
with,
way, yeah.
Novo Nordisk.
Okay.
Okay, let's move to the middle, maybe down here in the front.
I think I can use this facility.
If you press the
mic.
button, it works, yeah? Yeah.
So, first of all, I want to thank all the panel members. Mr. Moss, you have big shoes to fill for Walt Francis, and you've done a commendable job. And I do have a question from what Ms. Johnson said, but first, going back 2 years, Congressman, to Jerry's last hosting of this, he had the OPM director for FEHB programs. And I just want to raise an anecdote that Congressman Connolly did. One of his former colleagues, when he served on the Foreign Relations Committee, not a member, not a constituent, called him because, and this is about the appeals process, because he was turned down by his carrier, he was turned down in the OPM, but he contacted Congressman Connolly, his friend, for an experimental protocol, and I'm not going to, for a stage 4 cancer.
Yeah.
He was dying. And long story short, Congressman Connolly, through his contacts, called the director, and a member of the staff at OPM had gone through that same protocol, saved his life. Long story short, that saved his friend's life. I don't think we can do that. In this climate, not getting political, I don't think that can be done anymore, to save someone's life, to go above the OPM, judicial process, and save someone's life. So the question I have, and it's no one's fault on your, one thing you raised, Ms. Johnson, is I'm in FedVIP, I'm an annuitant, and I understand we get 2 routine visits and 1 emergency. But is that only for in-network providers, or does it also cover out-of-network? Because what I have is the Aetna High option, and I have $10 million of coverage for in-network and $2,000 a year for out-of-network. I go through the $2,000 like that. So is there still that disparity?
I want to answer I want to talk about the appeal first, just so everybody knows. Thankfully, that person you were talking about was able to use connections to have their case appealed. Everybody in this room, whether you're an employee or a retiree, has a right to appeal if you have a medical situation where it's not covered, or you feel like it should be covered but it wasn't covered. Everybody has a right to do that and go through the appeal process with OPM. It's actually called the Claims and Dispute Unit, okay? And a couple of you are shaking your head like I think you might have actually dealt with it before in the past. There's steps to take out, and it's outlined on the OPM website, also in your plan guide. But please know that that is actually open to everybody. I have gone through the process when trying to help an employee, and it turns out be approved for a cancer treatment drug. It was the same scenario. And it worked. We went to OPM, we wrote up the appeal, we put the justification, we had the doctor's information, and it turned out that OPM at that point has a right to overturn the carrier's decision if they feel like the decision was incorrect or not favorable to the employee due to what the reading was in the guide. So it was overturned, and that person did receive that cancer treatment. But I just want to stress that it is open to everybody. And if you ever need to go through that, go to the OPM website or look in your plan guide. All right. As far as the 2 routine exams and 1 emergency exam being covered under the dental, I believe it's going to be in or out of network. Do you know exactly, Kevin?
I would recommend just looking
Yeah.
at the plan brochure. We can
Yeah.
do that after.
Yeah.
I can walk you through it and show you where to go to find that out.
Yeah, we could do that.
Okay, let's go to this side here. Miana, this one, okay.
Good morning. I have a very quick question. I used NALC for over a decade, and I think on the website earlier this year they said, hey, we're going to be on for 2026. Why did OPM pull NALC from the FEHB?
Letter carriers.
Yeah, I don't have an answer as to the decision. I don't know if, I would doubt it was an OPM decision. They generally want the healthiest market with the most number of carriers. They want competition in the FEHB market. NALC remains in Postal Service. They're not in FEHB. I don't know the reason behind that. But you have a very important job over the next 6 weeks. It's just figuring out what plan is going to be the right fit for you. If you do nothing, you will be auto-enrolled into GEHA High.
Yeah, that ain't going to happen.
Hey, I want to add on to that because Kevin's not saying something. He wrote a wonderful article this week. Did anybody read it in Federal News Network? And it was, and I'm going to go ahead because he won't talk about himself. It was about, it was really directed to people that were enrolled in NALC that are under the Federal Employees Health Benefit Program. And in the article, he actually gave alternatives to think about. If you're looking at an HMO, if you're looking for a high deductible health plan, or you're looking for a fee-for-service plan. It was so good that I actually sent it to my colleagues. And if you find me during the break, I think I made a copy of some of his suggestions. So if you come and find me, I'll give it to you. You can have it, okay?
All right, let's move to the middle. Anybody in there's one right down here, and then we'll come back on this side.
Hi, I'm Beth. I have a kind of can you hear me?
Yes.
I have an unusual sort of question. So I am one of those 4,000 employees that has the privilege of getting a RIF during the shutdown. The courts have paused it but haven't reversed them. So we have separation dates of December 9th. So I'm just wondering about continuation of coverage. Should those of us in that position look at plans that we would want to have for January using that continuation of coverage? Select those during open season if we need to look for plans with lower premiums because our jobs are basically the April 1 RIFs out of my agency got 6 weeks extra of employment out of the court cases. So that's kind of what I'm thinking is going to happen again. So thank you for any advice you can give.
Yeah, I would suggest, well, there's a big caveat, and that is what's going to happen with the enhanced tax credits in the ACA. With the enhanced tax credits, there would probably be savings in the marketplace compared to temporary continuation of coverage. You probably know that you'll have to pay the full premium. There won't be a government share, plus there's an administrative fee on top of that. But without the tax credits, believe it or not, some of the lower cost FEHB plans will be more affordable than what you may be able to find out in the ACA market. So, I don't know what your current FEHB plan is, but you may want to look at, some less expensive choices there so that you can save a little bit on the premium. And then we'll just have to wait and see what happens, with the tax credits. If they do get extended, then that may be a less costly choice for you.
Could I add on to that? If you are, unfortunately, if that happens where your employment is terminated and you're not eligible to continue your health insurance into retirement because you're not retirement eligible, again, as Kevin mentioned, the Affordable Care Act is an option. Also, separated employees who are not entitled to carry their health insurance into retirement can also continue through TCC. We call it temporary continuation of coverage. In the private sector, you think of it as COBRA, right? But you could do it for only up to 18 months, and but it's not cheap. It's 102% because there's a 2% administration fee included. But if those credits are not extended, as Kevin said, that might even actually be a cheaper alternative than the Affordable Care Act. A third option for someone that cannot carry their coverage into into retirement because they're not retirement eligible is that they could call their carrier, whatever you have now. For example, say you have Blue Cross Blue Shield now, you can call Blue Cross and you can ask what non-group plans that you could enter into with them. You have to make sure you ask what does it cover and how much does it cost, because it's no longer a group plan. But those are three options: the Affordable Care Act, TCC, and calling your carrier to find out about a non-group policy that you could enter into. All right.
Okay, anyone on this side? Don't see. Why don't we come down the gentleman right here in the front, Maddie, with the blue shirt?
I'm not sure I can phrase this as a question, but it's a comment. And there's two separate ones. I'm just going to give the buzzword, and then I'd like to explain. One buzzword is silver scripts. One buzzword. Second buzzword is explanation of benefits. When I review my explanation of benefits early in the year, I review them each month whenever I get them, I review them. I have GEHA. I've had it for years and years. Obviously, I'm retired. I got in about April or May, I got an explanation of benefits that showed thousands and thousands of dollars against our plan, which we had no idea what they were. So I started, there were phone numbers and all, and I started calling the number, and it turned out it was some supply company in Florida. And then I called GEHA, my carrier, and they said, well, you notice we didn't pay anything because we're aware that this is a Medicare scam. And then I called Medicare. That may be the most painful thing I have ever done in my life. I told them, I told both people the story, and I don't know, and maybe you know, if I have high claims like that, does Medicare charge that against me in some way? Like, I am an IRMA person, unfortunately, and Part D, I didn't think I signed up for Medicare Part D. I never signed on the dotted line, but somehow I got in silver scripts. Oh my gosh. It said you can get out of silver scripts by going online, downloading the form, send it in. So I did that, and I work with CVS Pharmacy, and they tell me what the price of the drugs are, et cetera, et cetera. So on April 1st, Silver Scripts wrote me a letter saying, you have been disenrolled. Hallelujah. However, unbeknownst to me, the next time I get information, next time I go to the pharmacy, they say cost is XYZ. Well, I had been re-enrolled into Silver Scripts. And I said, I took no action. I should have called Congressman Connolly, Congressman Walkinshaw's office, because I know you guys provide all kinds of service for people like me who need help from above. But anyway, somehow, I guess I'm sort of in, I'm sort of out, and that's it. I don't know if, should I talk to you later about Silver Scripts, or, I don't like it personally, because I think I pay extra IRMA too to be in Part D, don't I? Mm-hmm. And I mean, I'm paying ridiculous amount, you know, I don't get a lot of Social Security benefits, but gee, Mindy, Christmas. All right, that's said it. If you want to comment.
Just two short comments. One, I would reconfirm with GEHA directly whether you are currently in or out of Part D. Mm-hmm. And if you're in Part D and you don't want to be, open season's the time, to get out. Okay? And it sounds...
You're saying get out of
Yes, during open season, you want to disenroll from Part D. In your particular case, understand that if your situation changes in the future and you start needing more prescription drugs and that $2,100 catastrophic out-of-pocket will start saving you money, you can go back in. Every FEHB plan is considered creditable coverage. You will never face any Part D late enrollment penalties when you're getting prescription drug coverage from FEHB.
What about the charges against the Medicare scam?
That sounds like fraud, and I'm not sure what phone number you called Medicare. They have separate fraud hotlines at Medicare. That may have been a more productive path, but if that's still an ongoing issue, talk to me afterwards and I can connect you with the right contact information.
Okay, let's go here. The gentleman with the hat, and then we'll
Thank you. Thank you for this forum. I really do appreciate it. Congressman, it's good to see you in your congressman job at this point in time. Very happy with that. My name is Patrick. I'm a new annuitant. I'm so new that I haven't even received my first interim payment yet, right? So I have two questions. The first one is, do you have any generic advice for somebody like me who's a brand new annuitant at this point in time? And then the second is, since I'm newly retired, I'm planning to move out of state. And I believe that's a life event which will allow me also to change my coverage if I want to do so, say, in the springtime. So any comments on that as well? So those two questions. Thank you.
Well, let me start, and then,
Okay,
and then
all right.
maybe
All right.
Mercedes can come in. Well, the first thing I have to ask you, it's a little uncomfortable because I just met you, but how old are you?
I look younger than I am, 56.
Oh, okay. Well, the reason I asked was because of Medicare. So you will, like, the one piece of advice is, like, when you're going to have an initial enrollment period 3 months before you turn 65, for you to make your decision in terms of whether you're just going to take Medicare Part A, which I assume will be premium free based on your work credits, and whether you want to take Medicare Part B. There's a case for and there's a case against that. A lot of it has to do with whether your income places you into IRMA, the income-related monthly adjustment amounts, where you have to pay the IRMA surcharge on top of the Part B premium. And then the second point is, yes, if you move, so let's say that you were in a Kaiser plan here in the DC area and you're going to move to, I don't know, let's say North Carolina, where Kaiser doesn't operate, that's a qualifying life event that'll allow you to switch to a different health plan. Go ahead, Mercedes.
Okay, you're young 56, did I hear that correctly? Okay, for me, that's young now. So, of course, you're not eligible for Medicare until age 65. So right now, the pressing issue is, first of all, we need your annuity to start, but also you're moving and you need to look at plans. So this is where you go to the OPM comparison guide, or you go to, which I love, the checkbook guide, my favorite, and you're able to put in your zip code, and you could look at the zip code where you're going to be moving so you can compare plans. You can compare plans, all right? Now, this is open season now. I don't know if you know when you're moving. It might be mid-next year. Huh? April. Oh, okay. All right. So the good news is, you could, if you love your plan right now and you do your shopping and you think you want to stay because you're in this area, you can stay where you're at. And then next year, moving is considered a qualifying life event. So like Kevin said, if you're moving to an area where your health plan isn't going to work, you can at that point reach out to OPM and you can change your health insurance. The only little caution I'm going to give you with qualifying life events, there's always time frames. So for example, I think for that particular qualifying life event, you can make the change up to 30 days before or up to 60 days after. Once you miss the 60 days, you got to wait for the next open season. All right? All right.
Okay, let's come down here, the lady in the blue sweater. The other lady in the blue sweater.
Oh, me?
No. Yeah, we'll go to you next.
Oh, okay.
Yeah. Yours looks green to me. Is it green or blue? Green, I thought. Okay, all right, we'll do blue and then green. Okay.
I'm Dorothy. My husband and I have had Geehaw High for several years. All of a sudden, it appears that they have retained United Healthcare to administer the plan. And since that has happened, we have a lot more trouble getting agreement to cover stuff. My husband has a sleep apnea machine for 20 years. He just had a new test that shows he still needs it, and they've denied him getting the CPAP machine. So we are contemplating open season. Have there been any issues with Blue Cross Blue Shield and denial of claims that before were quite easily accomplished?
So OPM administers a quality survey every year to a sample of plan members. They publish the results of that survey both on their plan comparison tool. We also have them on the checkbook tool, and we also publish disputed claim figures. It's really small. I just want to say it's a handful of cases that truly are disputed claims. Sometimes what happens is that the plan will deny something, and for whatever reason something was wrong, or the doctor filled out the wrong form and the claim gets denied. But most of the time those initial claim denials are reversed. Very few actually true disputed claims at the end. Is GEHA doing better than Blue Cross? I think they're very, very similar, but the quality data will help tell that story.
Well, we live in the Virgin Islands, but we were living here for 40 years. And when we had Blue Cross Blue Shield, it was administered through Puerto Rico, and we had a lot of trouble getting things paid to our physicians there. And that's why we switched to GEHA. But we live basically half and half here and half in St. Thomas. But that's why I'm concerned about switching back to Blue Cross, that maybe the same thing will happen if we still have to go through Puerto Rico for claims.
Maybe next year we'll do this event at St. Thomas with your house. All right.
I'm coming.
Okay, we'll go right here in the green.
Okay, a couple of quick questions. The first one for Ms. Johnson. You mentioned something about one plan that covers diabetic care 100%. Could you save me some footwork and tell me what that is?
I don't know it offhand, but if you come up to me later on and give me your contact information, I will find out for you.
Okay, thank you.
I don't know the exact name of the plan, unless Kevin does. Does Kevin know?
Not right now.
All right. We're good. We're not that good, you all.
Okay, the other is that I am now in NALC, which is disappearing. I have the Medicare Advantage, and it's through Aetna. And I was hoping maybe I could just switch to an Aetna, but I don't see that on the vendor list, so.
Yeah, I've got you. Aetna Advantage is the plan to look at.
So there is one.
Yeah, they have a $100 a month Part B premium reimbursement, zero out of pocket for approved healthcare services from providers that accept the plan in Medicare, besides prescription drugs, plus they have numerous supplemental benefits. So I would start with that, but you also probably should consider United Choice as well. United Choice has a greater Part B premium reimbursement. It's $150 a month. And still that zero out of pocket. And one benefit of the Medicare Advantage program that FEHB administers versus the CMS commercial Medicare Advantage is, let's say that you were in that United Medicare Advantage plan, you don't have to wait till open season to get out. You can switch back down to that United FEHB plan throughout the year, which is something that does not happen in commercial Medicare Advantage. So it's a big difference. And one last one, GEHA Standard. They also have a Medicare Advantage plan administered by United.
Thank you very much.
Okay, we'll go here in the orange, and then Chris, there's one in the back there, if you can be ready.
Thank you for doing this again. It's really helpful to me. Last year I switched from GEHA to Compass Rose, mostly on the advice of Walt Francis, and I was very happy with that, especially after the big snafu with Silver Scripts. But United Healthcare, which administers both GEHA and Compass Rose, kicked out my whole healthcare team, including the two closest hospitals, out of network at the end of August. So do you have advice for people without B?
It sounds like you were going to Johns Hopkins providers.
Yep.
There was a big dispute between United and Johns Hopkins. As of right now, that dispute has not been resolved, and so Johns Hopkins is considered out-of-network with United. One thing that we didn't talk about in terms of just overall advice to do every year is checking providers. And again, you will have to go to the carrier website. There are provider search tools there where you can put in your providers, see which plans your providers will be in network. If you're in Compass Rose, I would take a look at like a Blue Cross Basic. They do not use a United provider network. They have their own provider network. I would start there and see what if your providers are still in network there.
Also, you don't, without Part B, is what you said, correct? Okay. I am a fan of Blue Cross Blue Shield Basic, by the way, but you do, when you're looking at look at your current providers, like Kevin said, but you want to make sure when you call them to ask them, are they within that Blue Cross Blue Shield network? Because if they aren't, then Blue Cross Blue Shield Basic is not going to cover. So you do want to check that out. But I am a fan. I love Blue Cross Blue Shield Basic. Make sure, I think it's a good suggestion.
Okay, in the back, Chris.
Good morning, thank you. I'm currently a Kaiser member here in the Northern Virginia area, but I'm going to be moving to Oregon probably next September. And looking at the plans on the tool, in some cases the copay is listed as a percentage rather than a dollar amount. And how do you know how much a basic office visit is for your coverage?
Yeah, it's
a hard one.
It's a huge problem, right? And it's like one of the knocks against high deductible health plans. Most of the benefits are stated as 10% coinsurance after deductible, and you have a choice in your head, well, what is it before and then what is it after? I still don't know what that price is. Mm-hmm. These prices are not published, right? You can't find them on the carrier website. You can't find them on the plan brochure. You can't find them on the carrier website. The best you can do is call the plan and ask them, if I'm in network and I go see, I'm sick and I go see a primary care doctor, how much will that be? This is called the allowed charge of the plan. And by procedure, you can call the plan and get a price over the phone. There's a little administrative friction there.
Okay, gentleman right here in the gray.
Oh, one last thing. You're in Kaiser and you're moving to Oregon. Kaiser's not available in the entire state, but there's certain areas within Oregon that are Kaiser markets.
Right, unfortunately, Ben is not one.
Okay, Sorry about that.
I had a question about the so-called advantage of Medicare Part D. I'm thinking about getting a non-preferred brand drug, and I was checking both Medicare Part D and my Aetna Direct plan that I have. And from the information I got from the representative at Aetna, it seems that my prescription course for this non-preferred drug would be less through Aetna as opposed to Medicare Part D.
Interesting.
And I'm wondering whether or not I've gotten any sort of misinformation based on one of your speakers here that praised the Medicare Part D option in terms of saving some money in terms of your prescription drug. What I checked out for next year for Medicare Part D for this non-preferred drug was that over the first 4 months of the $2,000 deductible, but over the first 4 months she'd be paying an cumulative amount of about $615 approximately, and then for the last 8 months it'd be something like $38 a month. If you went to the Aetna Direct, according to the person I spoke to at Aetna, it's a straight $45 a month, which seems to be cheaper than the Medicare Part D option. Did I get any misinformation there, or is that something that is really realistic, where you can actually save money by not going to Medicare Part D for non-preferred drugs?
So it's not supposed to work that way.
Yeah, I've never seen that.
To receive approval from OPM, the Part D plans have to provide equal or better coverage than the FEHB prescription drug benefits. So that includes the formulary, which is what drugs are covered, and out-of-pocket costs. Worst case, it's supposed to be the same. In many cases, when I go and look at this, I sometimes see a little bit of savings on Part D. I would take a look again. And if you want some help after this, we can pull up Aetna's site and we can look at your drug and we can compare that to Part D. I'd be happy to help you with that if you come see me.
I want to add on about the prescription drug Part D. As Kevin mentioned right in the beginning of the program, that folks that were enrolled in Part A, Medicare Part A or Medicare Part B, doesn't matter, A or A and B, were auto-enrolled in the prescription drug program. And I think someone up front was talking about his experience and trying, because you can't opt out of it, okay? And then use your prescription drug coverage through your plan as you normally would. There are a couple plans, and I just want to mention this. I was looking at one yesterday where they've stopped opting people in automatically. So it's not an automatic enrollment. Based on feedback that they got from some of their members, now, so a couple plans are still doing that. They're automatically enrolling, but there are a couple that are not, where if you want that prescription drug plan, you have to actually proactively enroll by calling that plan. So I want to make sure I say that.
Okay, be right here in the front.
This doesn't have to do with a plan, but I have a bleeding clotting factor that is almost non-existent, and so I have to go to an infusion clinic before I have any kind of surgical procedure, dental or whatever. They have closed down 2 of the infusion clinics in this area at Alexandria Hospital and Mount Vernon. Now they only have 2 left. And I'm competing also with cancer patients who need infusion on a regular basis. And if there's anything you can do to bring that attention to that, it's definitely a need, a great need in the area, and the hospitals seem to be closing it down left and right.
So they were Innova clinics that closed down, and they consolidated into fewer locations, or?
Correct.
Yeah,
now
okay.
There's just, instead of 4, now there's 2.
Yeah.
And trying to get, I have to have the infusion on the same day as the surgery.
Yeah.
And trying to coordinate that between the doctor and the infusion clinic is becoming horribly difficult.
Yeah. Thank you for sharing that, and I will share that with Innova leadership the next time that I see them and talk to them.
Thank you.
Thank you. Okay, we've got a lot on this side. Maybe the blue shirt, and we'll try to work our way up the row, and we're going to do 15 more minutes of questions and wrap at 11:30, and our guests are able to hang around for a little bit and try to answer specific questions. Yes, ma'am.
This is just a quick question. You mentioned the HSA and the FSA. So I've only done the FSA. I haven't really researched the HSA. Can you explain how those work? Can you have both? And just some more detail on that. Thank you.
Yeah, I could talk for 15 minutes about it, but I won't. I'll try to do it in 1 minute or 2 minutes. So the first part of your question, you cannot have a general purpose FSA and an HSA, but you can set up what's called a limited expense FSA just for dental and vision. And I think it's smart to do it because you can use that limited expense FSA for your out-of-pocket dental and vision, and that you don't have to touch the HSA. Okay, HSA, you have to enroll in a high deductible health plan. That's step 1. What's amazing about the FEHB program with high deductible health plans is there's something called a premium pass-through, where a portion of the premium gets deposited into the HSA on a monthly basis. This is not you putting your own money in. This is the plan putting money into the premium. So if you're self-only, that amount is somewhere between $900 to $1,200 a year. If you're self plus one or self and family, it's double that. And then on top of that, you can put in your own money. One bit of good news is that the HSA IRS issued a contribution increase to the HSA. You can put up to, between you and the plan, $8,750. So one huge benefit of the HSA is basically more than doubling of what you can put into it a year. Okay, you can then also invest those funds. So much like with a traditional IRA, there will be a financial institution that manages the HSA. Depending upon your financial sensibilities, if you want to be conservative or aggressive, you can invest as you see fit. anything you put in is triple tax advantaged, right? You can either do a payroll deduction or a lump sum into the HSA. It grows tax-free. You never pay taxes on the growth, and it comes out tax-free for any qualified medical expenses. Once you turn, I think it's 55 or 56, you can do a catch-up contribution and throw an additional $1,000 in. And once you turn 65, there's no tax penalty for a non-medical distribution. So in many ways, it becomes almost like a traditional IRA at that point. You can use it for Medicare Part B premium reimbursement, any other out-of-pocket healthcare costs, or do anything else with it. If you decide to take your family to Hawaii, you will have to pay your normal taxes on it. So I think the high deductible health plans generally have lower premiums than a lot of the PPO plans. What you won't like about it is that the deductible is higher, and what we talked about earlier, that it's a little bit hard to know what something costs in a high deductible health plan because it's quite common to see things like a 10% coinsurance, and you're like, but what does that mean? How much am I going to pay when I go to the doctor? You can call the plan to get some of those answers. If you want more information, you can come see me after this.
Also, I just want to add on to that. For self only, it's $4,400. For self plus one and family is $8,750. So it depends on whether you're self or self plus one and family. But yeah, the HSA is a wonderful program. If you do the FSA, you can enroll in the LEX, which is the limited expense, but Kevin just talked about that.
Okay, Jim, do you have any idea when the Medicare premiums and IRMAs and brackets and everything will be finalized? And also for checkbook, I checked the Postal Service checkbook yesterday and it wasn't loaded with 2026 yet. When will that be?
All right, I'll take both, but maybe the congressman has more information from CMS. So all we have right now is the trustee projection on what's happening with Medicare. And last year, it was the first week of November, which we're there. So I would expect very soon we're going to be getting the finalized numbers. But the trustee projection, I think most years, is fairly accurate in terms of where that's going. So do expect to pay a higher Part B premium. Postal, OPM was about 10 days late releasing all of their information this year. So we're a little late too. We'll have it out probably by Wednesday.
Okay, thank you.
Wow, that's great.
Yeah, nothing to add on CMS. My expectation would be this upcoming week, but we'll see. Okay, did we have one in the back? Okay, Maddie?
Hi, good morning. Again, thank you all so much for being here. This is really great. I just had a question, please. I have a double whammy next year. I'm a civil service employee. I'm still working. But I have one child who's going to need wisdom teeth removal, and I have another child who's going to need braces. So it's $5,000 for each procedure. So I'm really looking at the VIP programs. And you kind of mentioned earlier that there's a contract rate, like an allowance rate, and I'm just wondering, I have been contacting the companies, I've been contacting the providers, and apparently there's a contract rate for each procedure, and they keep referring me back and forth, and I was wondering if there was do you know if they're supposed to reveal that rate? Because let's say it's $5,000 for the procedure, well, they may contract for, let's say, hypothetically $4,000, and they'll only pay up to $4,000, but every provider seems to have a different contract rate. And I was wondering if you have any recommendations on that, please.
Yeah, not on the contract rate, but if you're thinking about Fed VIP, one thing that you're going to pay real close attention to is that with orthodontic benefits, there's generally a lifetime benefit per person. And it's unfortunately probably not going to cover the cost of one orthodontic procedure. I think it's very common to see something like $2,500 or $3,000 on a lifetime orthodontic. There could be a couple of plans that have a higher benefit than that. If you're an active employee, you are a max out FSA candidate. You will use every dollar of that, and so you definitely want to take advantage of the flexible spending account and do the full max if you expect to pay out of pocket for orthodontic next year.
Also, make sure for the dental plan that you're looking at under FedVIP that there isn't a waiting period for orthodontist work.
That's gone.
Oh, it's gone? Okay.
Yeah, they removed that 2 years ago.
Okay, all right.
So, yeah.
Oh, well, sorry.
It's okay.
Sorry.
All right. Anyone else? Is there one in the back with the red shirt? Or, yep, go ahead. Pick one up there. We'll get to both.
Good morning, everybody. Thanks for this opportunity. I retired about 2 years ago, and what I've heard here is more on the Medicare Advantage and not the supplemental one. So I was wondering, is Medicare Advantage better than the supplemental insurance? Because I got into Blue Cross Blue Shield Basic, which ended up having a Medicare Part D program. So I was put into that. So I'm just wondering whether the supplemental is better than Advantage. And
Are you enrolled in Part B?
Part B, yes.
You are enrolled? Okay.
Yeah, I retired about two years ago at 70. Yeah.
Do you want me to take it? Or you want to take it?
The language is a little bit tricky. When you say supplemental, in my mind, I think Medigap, which is very different than Medicare Advantage. And it's also something I do not recommend to federal annuitants, because your FEHB plan is basically Medigap insurance, right? When you're an annuitant and Medicare becomes primary, your FEHB plan becomes secondary. Adding Medigap on top of that and paying an extra premium isn't really going to be doing much for you. I don't think it's a great option. Blue Cross Basic is one of those plans that does coordinate very well with Medicare. You get $800 a month, or not a month, I wish it were that. No, $800 a year in Part B premium reimbursement and zero out of pocket for Part A and Part B services. All that being said, there are Medicare Advantage plans. We talked about some Aetna Advantage, GEHA Standard, United Healthcare Choice plans that when we model these plans, we see lower estimated yearly costs than a plan like Blue Cross Basic. So I think open season is a great time to consider those and see if they may work for you.
Thank you.
Okay, and there was another one in the back there?
Yes. I'm Sheila. I've been with Blue Cross Blue Shield for 50 years, and I'm retired, obviously. We have Blue Cross Blue Shield 106. I'm paying $832.31 a month. We have Medicare, A and B, and my husband has Part D. I really need help. We're really paying over $1,200 a month for health insurance. I talked to Blue Cross and Blue Shield because my husband and I need physical therapy, and they're not paying, well, they only pay what Medicare will say they will pay, and the rest of it, we have to pay out of pocket. So I really would like to talk to somebody after this session about what the best way to go.
It sounds like you have the Blue Cross Blue Shield standard option.
Yeah, we have the 106.
Okay, 106, yes, standard. That's Blue Cross Blue Shield standard. Kevin had just mentioned some of the Medicare Advantage plans, and I always say underneath the FEHB umbrella. I'm not talking about the commercial ones through Medicare.gov. For example, and I'm going to use Aetna as my example. Aetna Medicare Advantage plan would be significant, would save you so much money on premiums. You already have Part A and Part B. That's a requirement to have it. Plus, they have extra benefits. And I think I was looking at them yesterday. When it comes to physical therapy, speech therapy, you're going to be paying zero out of pocket, unlimited visits. Plus, they offer extra services. The Medicare Advantage plans within the FEHB umbrella will offer, and I'm just going to say it real quick, extra benefits like non-emergency transportation. They'll drive you to the doctor's office or the pharmacy if it's not an emergency. If you're in the hospital for a certain amount of time and you come home, they'll bring you, I think Aetna gives you 14 meals. Yes. You know, I don't know how they taste though, so don't hold me to that. They have home healthy visits. There's so many other advantages, but I am thinking that you would probably be a candidate for maybe a Medicare Advantage plan underneath the FEHB umbrella. Kevin, do you have anything you want to say? Plus, you can get some premium. With the Medicare Advantage plans, there's a premium reduction feature where it'll reduce the amount of your Part B premium. Plus, Aetna is considerably cheaper than a Blue Cross Blue Shield standard, but they're not the only Medicare Advantage plan.
Yeah, the cost savings are certain. What's not certain is your access to providers or the prior approval or prior authorization process. So before looking into any Medicare Advantage, you want to see how your providers are going to be covered, and then understand that one of the knocks about Medicare Advantage is that they have higher prior authorization or prior approval. But, you know, within FEHB, many of these services also require prior approval and pre-authorization as well. So, but the cost savings are certain.
If my husband had to go to the hospital, right now, we don't have to pay anything. So under Aetna Advantage, would I have to pay something?
In the Medicare Advantage plans that were mentioned, zero out-of-pocket for inpatient hospital.
Okay, how about lab work and that kind of thing?
Zero.
Blood work, MRI, CT, zero.
All major medical is zero besides prescription drugs.
The only thing you're going to pay for is your out-of-pocket prescription drugs, but you have to have the Medicare, it's going to be through the Medicare Part D, Medicare prescription drug program.
Okay, I think we'll do one more, because I saw your hand just pop up right in the middle, and we'll make that the last question, and then our guests will be here to answer more specific questions. Yeah, right in the middle.
HSA and HRA. What are the difference between HSA and HRA? I understand what the FSA is.
Okay.
But those two I don't understand.
All right, so there's something called consumer-driven health plans. Consumer-driven health plans have an HRA. That same, concept of the plan giving you money towards a savings account.
Right through those doors. Yes, the vendors are right over here. Let me.
Okay. I think, Anna, your mic's on there.
Right over there, head straight.
Okay, you get the same savings account contribution. You get it all at the beginning of the year. But there's a huge difference between an HRA and an HSA, okay? And here's some of them. One, you cannot make any non-medical distributions out of an HRA. Two, if your plan leaves FEHB or you switch plans, any unused funds you have in your HRA, you forfeit. So anyone who was enrolled in, let's say, NALC, CDHP, and FEHB, they're going to forfeit all their funds left over in an HRA next year because their plan is ending. I think those are the main ones. So high deductible health plans, you get the HSA while you're working. But once you have Medicare, instead of getting the HSA, you get an HRA from a high deductible health plan. So annuitants receive an HRA from a high deductible health plan with all those same HRA rules, which are no non-medical distributions. You cannot put in your own money. The money is not invested. When you have out-of-pocket health care, the plan's going to pull from that HRA first, and it will draw down that HRA. And if you continue to have services, then you will at some point have to pay your own money if you run out of money out of that HRA. But unused money does roll over to the other year, although some plans have a ceiling in terms of how high that HRA balance can go. It's something like around $5,000 self-only, $10,000 self+1, or self and family.
One other thing I want to say about that, because some of us are a little bit older, with the HSA account, once you are enrolled in Medicare, you cannot contribute to the HSA anymore. So I want to make sure you keep that on your radar as you get older.
Okay, well, I want to thank all of you for joining us again this year, and just a couple of announcements before we wrap up. One, you can see I have my sticker because I just voted, so you're here. You have the opportunity to vote early. Today is the last day to vote early in the election that's taking place on Tuesday, so you can walk right out there and get in line if you're registered to vote in Fairfax County. And there's actually 2 elections where you can vote early. On the second floor here is the governors and lieutenant governor and attorney general and House of Delegates. You can vote early there. If you live in the Braddock district, which is the district that I represented until I was elected to Congress, there's a special election for that district on December 9th. You can vote early in that election on the 3rd floor. So you could do both and not have to worry about it on Tuesday or on December 9th. We also have our vendors set up in rooms 7 and 8, so several of the vendors there can answer more of your questions. Please join me in thanking our incredible guests, Kevin Moss and Mercedes Johnson. Thank you all so much, and they've graciously agreed to hang around and answer a few questions from folks that might have specific questions. So thank you all.